I bid you all good morning, good evening, good night, wherever you may be watching this transmission. It is I, your old pal, Mike Martins. Thanks for joining me, guys. Guys, we had a heck of a Mike in the Night last night. It's here on the channel. You'll see it as the first video. If you go to video there, Mike in the Night, what a heck of a video. We had all kinds of guests come on, all kinds of points of views come on, all kinds of different angles. It's a really good episode. If you haven't seen Mike in the Night from last night, I'll have it at the end of this video. It gets pretty testing at the beginning when I'm trying to get the Skype to work, but then the show gets really good. So, check it out, guys. Okay, anyways, hospital bankruptcies leave sick and injured nowhere to go. This is from Bloomberg. This was sent to me by The Raven. The Raven's always watching out for good articles. So if you guys have an article or something you want to send me, go ahead and send it to me on my Facebook fan page. I'll show you how to find it. Hospital bankruptcies leave sick and injured nowhere to go. So this is happening in the United States of America. So here are the key points of the article. At least 30 hospitals entered bankruptcy in 2019. Election-related uncertainties, complacent business planning. So if people can't afford healthcare or afford insurance, you're going to start to see a lot less visits, right, to the hospital. A quiet crisis is unfolding in U.S. hospitals with bankruptcies and closures threatening to leave some of the country's most vulnerable cities without care. A gauge of distress in the healthcare sector has soared. At least 30 hospitals entered bankruptcy in 2019, according to the data compiled by Bloomberg. They range from Hahnemann University Hospital in downtown Philadelphia and DeQueen Medical Center in rural Sevier County, Arkansas, and Americore Health LLC, company built on preserving rural hospitals. Rural hospitals are important. I live in a rural city, and I need my rural hospital here, at least to tell me to go to the big city if I need to, right? There's more distress to come already this week. The bankrupt owner of Saint Vincente Medical Center in Los Angeles said it plans to shut the facility after a failed sales attempt. The pressure of the sector are as tangled as the healthcare system itself. Is America going to have to go towards socialized medicine? Canada has it. I mean, it's kind of there. I mean, Americans are fleeing rural areas in favor of urban centers, reducing the demand for hospital services in already struggling communities in both cities and towns. Many hospitals that care for impoverished cities are often rely heavily on government payments that reimburse less than private insurers and may fail to cover rising costs. So it's a huge mess down there. The American Hospital Association and industry group calculated that payments from Medicare and Medicaid, the federal governments, for the elderly and poor lagged the cost of $76.6 billion in 2018. Hospitals are losing key income as more profitable procedures move lower cost outpatient centers. But you're still having the walk-in clinics, outpatient centers, where you don't have to go to a hospital anymore. You just go see your doctor, or you go see if you need a prescription, right? How are you supposed to craft a business plan if you don't know if you're gonna have an America with a Medicare at all, or a complete repeal of the Affordable Care Act, or a million options in the middle, said Sam Miazil, a partner with Denton's U.S. LLP law firm who focused on healthcare restructuring. If you know Elizabeth Warren was going to get elected, you'd be writing very different business plan. So it's all about who's running for president, who's going to win, and who may get the vote, right? So that's very hinged on American politics, right? Ailing hospitals. At least 30 hospitals in the U.S. entered bankruptcy in 2019, bankruptcy reported. I would honestly, like the Canadian government here, basically saw a lot of ailing media, our media platforms, or not our social media, but our mainstream media was ailing here in Canada. So the federal government, 6 months before the election, just dumped $600 million into it. I don't see why it would be, even though this is private sector, I don't see why they don't create a small layer of government, right? One regional manager per state, and They basically allocate funds, government funds. One regional manager, one per state. They would drive around to every different hospital. They do 6 hospitals a week. They'd go to every hospital, and what they do is they confirm, okay, you're needing, all right, here we go, take my notes. I'm going to go ahead and send this to get you a check in the next couple of weeks or a month. Done. I don't see why they did it. The Canadian government did it without even sending administrators to our ailing mainstream media, right? So I don't see why it would be a bad thing for them to do this in something like this, in a situation like this. Even before the election, the current system is being challenged. According to Georgetown University healthcare policy professor Edwin Park, the Trump administration is trying to tighten eligibility rules for Medicare, while a rule proposed late last year could also cut billions of dollars in supplemental payments to hospitals, he said. In a closely watched case, and district judge of Fort Worth, Texas, is weighing whether Obamacare can survive after the appeals court ruled its board mandate requiring people to have health insurance was unconstitutional. I think forcing people to take something they don't need or want or can't afford is unconstitutional. And a lot of people did not take Obamacare because it was just too damn expensive. They'd rather pay the $5,000 fine every year for not having it. The usual playbook for managing distress doesn't readily apply. Shutting down a hospital isn't the same as boarding up a storefront. Hospitals are not only major employers. Their closures often leave most vulnerable patients bereft. Okay. Bankruptcy, or screwed. Let's say screwed. Bankruptcy judges tend to push back on approving hospital closings in ways they wouldn't for a retailer, said Andrew Sherman, head of restructuring and law firm Sills, Combs and Gross PC. Well, usually if it's a big corporation, they just dip into the repo market. Do you know what I'm saying? They don't have, you know what I'm saying? So in May, a 25-bed hospital in Sevier County, Arkansas, shut down after sliding into such financial disrepair that the receiver was appointed. Local newspaper, the DeQueen Bee, reported for many of the county's 17,000 residents, the hospital's emergency room provided the only such services within hours' drive. Court papers show in suburban Chicago, Westlake Hospital was losing more than $1 million a month before it commenced liquidation bankruptcy in August. It's a lot of money if it's privately owned. You're losing $1 million a month. That's a lot of cake. Sapping that community of about 550 jobs and 230 hospital beds. So, for a worksheet, hospital bankruptcies, click here, and there's a bit over here, a distress thing here. In many rural areas, the population just isn't large enough to justify keeping the lights on, according to Bloomberg intelligence analyst Mike Holland. Morgan Stanley analyst led the Vercom Malhotra. The 2018 found that 8% of hospitals were at the risk of closing. Another 10% were considered weak. AHA statistics released Tuesday that the number of U.S. hospitals fell by 64 to 6,146 in 2018, the most recent year available. Now, guys, pay attention to this. So my way of fixing this, how can we fix this? Okay, then in these areas like this specifically, right? I would just put a walk-in clinics here. And if people in the rural areas need a hospital, they could charter them an ambulance or could do something or airlift them if it's something super major, right? So if that's the case, instead of just losing everything, just put 3 walk-in clinics here, and then you're not that far from Seattle, so depending on the severity, there's always something, right? You could always figure something out, right? Logistically, we just didn't get out of we just didn't get out of bedrock. We have ways to move things around, right? Industry distress. Healthcare bankruptcy filing index has soared in recent years. Here it is. So you're seeing it here, and this is Q3 of 2019. So source distress index uses 2010 as a base year to track healthcare bankruptcies. So it goes back, right? Since 2010. So there's little reason to believe that the situation has improved, which tracks the bankruptcy filings in healthcare sector. sector had nearly quadrupled in the third quarter. The index uses 2010 benchmark. Debt piles. Community health, meanwhile, has piled up $5 billion in losses in recent years as it labors under more than $13.5 billion in debt. A concentration of rural hospitals dependent on Medicare and Medicaid hurts community health. Buys Holland said expanded insurance coverage under the 2010 Affordable Care Act or Obamacare has means for more people are getting care earlier and not ending up in the company's hospital, he said, or are being directed to lower cost outpatient facilities. So this is dangerous, guys. This is very, very dangerous in what's happening here. This is a very good, really, really well-written article by Bloomberg, by Lauren Coleman, and Lochner, and Jeremy Hill. I guess they're covering this. This is from yesterday. It's from 2 days ago. And the Raven sent me this because he felt that, this is a very important article that needs to be covered here on the channel, because this is what we cover. We cover the breakdown in infrastructure, the breakdown in basic necessities, the breakdown in energy, the rise of gold and silver, the takeover of governments. You know what I'm saying? See, government needs to go in here and start spending money, right? And start, that's what I believe, right? We have socialized medicine in Canada. It isn't the worst, okay? When my dad got really sick and he was dying of cancer, they took care of him right to the end. And they brought him a bed home because they knew. And it was very peaceful for him. But they tried everything. They threw everything at the board. But it was just too late for him. And you know, it's all there. It's there. It's there for everybody. Guys, don't forget, please, to subscribe to the channel. Don't forget to click here and join the channel if you can. And shop, buy a sweater or a t-shirt from Mike in the Night or Trends in the Housing Market or the other shows I do. And if you want to be a Patreon supporter, go ahead. And Subscribestar, I'm still on here too if you want to join. And guys, if you want to message me, this is how you message me. Go to Facebook, type in my name. You'll find my fan page. That's what it looks like. The problem with my fan page is there's like 3 fake ones. I think they're down now. But I'm the only guy with 17,000 fans on Facebook. 17,000. I'm the only guy. So there's no questions. If there's no other Mike Martins with more than, I think, 100 fans on their page. So let me know. And if you want to shoot me some change in PayPal, you could find all the links up top here on my channel. Thanks for your support. Lots of love, guys, and see you in the next video.